Considering diabetes tests if you are worried about some of your symptoms is a wise decision. Type 2 diabetes is on the rise, and a diabetes diagnosis can help to curb an otherwise unhealthy lifestyle, and can even be reversed through diet and weight loss. It is important to understand that there are two very distinct differences between type 1 and type 2 diabetes. Type 1 is not at all weight-related, and type 2 is if the blood glucose levels are too high. Then a diabetes urine test may be carried out, which would measure for ketones in the urine. If the blood glucose levels are high, it is referred to as hypoglycemia, and this needs to be. Hypoglycemia means there is too much sugar in the blood, and this needs to be restored. Exercise can burn this excess of sugar off, and so can drinking more water. This means that extra toilet breaks should be factored in if this is during work or study hours. During this time, taking a diabetes urine test will measure the ketones in the urine, and if present, a blood test to determine the level would be needed. When patients receive a diabetes diagnosis, these issues are discussed in depth with the patient. The most important thing is to get that initial diabetes test so that you can be treated if unwell. Many times you will hear patients say that it is better to have hypoglycemia than hyperglycemia. This is only partly true, as being too high can lead to complications also. When a diabetes urine test has confirmed there are ketones present, the person may have stomach aches or nausea associated with it. This is not unusual, and this can most often lead to the initial diabetes diagnosis for many people. They have terrible stomach pain for no apparent reason, and after a diabetes test is performed they suddenly find a reason